Hello, everybody. I'm Theodora Scarato with Environmental Health Trust, and I'm here with Dr. Annie Sasco, and we decided to do a Facebook Live because we have been at the National Toxicology Program external peer review, where we were just so impressed with the incredibly comprehensive review of all the data from the world's largest study on cell phone radiation in rats, where they really tried to mimic the intense exposures that people get from cell phones in all the tissues.
Well, I am an MD, a doctor, and I have been all my lifelong cancer epidemiologist, meaning that I have been looking for the causes of human cancer, switching over time from the lifestyle risk factors like smoking, alcohol, drinking, to the environmental one. And one of the things which changed most in the past 30 years has been, in fact, the exposure of people to all kinds of sources of electromagnetic fields or radio frequency. What do I mean by that? It's the use of cell phone, it's the cell phone towers, it's the Wi-Fi in your homes, it's a lot of so-called connected apparatus all over the house. It's all these kind of things that we have been using and which unfortunately present risks for the health of the people.
Right. So you've been working on this for many years.
Many years. I guess, yeah. At least the past 15 years, I've been following that very closely. 20 years.
Do you want to give a recap of what the findings were today?
Well, I think I will first give a recap of what is known nowadays about the risk linked to exposure to EMF. The best studied phenomena, at least the one with most results available, is the epidemiology of brain tumors in humans. It's the fact that several studies done in the Nordic countries, in international studies with many countries participating, and more recently a study in France, all these studies agree to the fact that if you are a heavy user of cell phone, as it was defined in the past, meaning people who have been using cell phone for more than 10 years, more than a given number of hours, 2,000 hours in their lifetime in one study, 900 in another one, or people who are using their cell phone more than 30 minutes per day, and I think that's one of the most relevant, have an increased risk, double the risk of getting a brain tumor compared to people who are not using a cell phone. So that we already know. But given it's limited in a way to the so-called high exposure group, there was a need for more studies, including studies in rats and mice, as the one which has been done by the NTP in the US and reported recently for a preliminary report. In that preliminary report, a number of sites of tumors were found at increased risk, in particular some tumors of the brain of a rat, but also very rare tumor in the heart of rats, which is called schwannoma, which is a tumor of the nerves within the heart of a nerve shell. So these results were published along with some other increased in various organ sites of rats, but were judged as most of them equivocal. So meaning, yes, there may be a risk, but we are not sure. And what we experienced today was to see how some of these evaluations could be upgraded, meaning that for schwannoma as well as for glioma, it was decided that the evidence, which was before some evidence, became clear evidence. And for some other tumor sites or in different species, because there were differences between rats and mice, between male and female, where the evidence was considered more limited, equivocal before, then for some it was upgraded to some evidence. So in fact, there has been an upward reevaluation of the evidence of carcinogenicity.
Right. So, and they were specifically that the schwannomas of the heart in the male rats were upgraded from, well, the vote was, the peer reviewers voted that it should be upgraded from some
to clear
evidence to clear evidence in male rats in the GSM and CDMA groups. And then when it came to the brain tumors, the gliomas, which previously was in the technical report, the draft, it said equivocal, meaning uncertain. Did the radiofrequency cause it or not? We know there are increases, but we're not certain. And the external peer reviewers voted with their opinion that it was in fact some evidence, which is quite important. And one of the things they raised is that they were seeing these increases. It wasn't just in one group. It was because they did two modulations of cell phone radiation, GSM and CDMA, which are two ways that the cell phones communicate. Different phones in different countries use different technology, and actually this technology is of course moving out and 5G is coming in, but this is what they studied. It was initiated so long ago. But now the scientists in reviewing it voted, and the majority opinion was that this is stronger than equivocal. It is some evidence in terms of the brain cancers. So this is extreme. And I would urge everyone, one, if you want to ask a question, please do. Also, to take a look at the webcast that will be put up. It's not up now, but the National Institute of Environmental Health Sciences will be posting the last 3 days of discussions by the scientists. They reviewed the data. It was an incredible experience to hear the deliberations as they asked questions of the scientists who did the study, and then really discussed, like, among themselves their opinion. And one would say, well, I think this, and then the other scientists might say, well, here's why we did it this way, and then another scientist would ask a question. And this was just a wonderful it was really important to see how scientists deliberate on this issue, and also on the science itself and the data. And they said this is clear evidence. So this is really, really important, because these findings happened at levels where it shouldn't have happened. They would be considered non-thermal levels of exposure. And the United States FCC, the assumption that our federal guidelines are based on is that the levels that were used in this study should not have caused any health effects, and yet all of these effects were found. And it was not just in the heart and brain, but also there was findings in the prostate.
Prostate,
and what happened with the thyroid? I actually
was also something for a thyroid.
Yeah, there were
a number of organs are affected. And also we have to mention the fact that exposure to these radiations also has an influence on reproduction, on not so much the weight, the gain in weight during pregnancy, the weight of some of the newborns. So it's really something which is very important.
Right. So one of the things at Environmental Health Trust we've been really working on getting the word out is how to reduce exposure, because there are so many ways to reduce and limit exposure to radiofrequency radiation. And I would say one of the most important things is to get a corded phone. If you if you can, at home and in the office, whenever you are in a fixed location, to have a corded phone that has the curly Q on it. Now, if you don't have a copper landline, because for many of us, we're not even able to have copper landlines anymore. Our home does not have a copper landline. So what we do is we have a voice over IP where we can plug this, it's called VoIP, and you plug it into the Ethernet cord, and then you plug your phone into it, and you have a phone number, and you have a corded phone. And this is a really important for people to know. So everyone can have this corded landline, I hope, in their home. And also when you use the internet, if you can connect with an Ethernet cord, I'm going to go get one as an example, because we have one.
Go ahead. Else in the same room or in a bag, if you have a bag, that's much better.
Right. So I'm wondering if any, I don't even know how this right? That
No,
because there are
Yeah,
likely
of course.
even far more than we know, but we know enough to know that there are health effects found
Yeah.
at levels that are, that the governments are not protecting us from right
Exactly.
now. So we really need meaningful policy change, because we can change the way we use technology, but we can't change all this exposure that we made no decision and
Exactly,
we didn't consent to
exactly,
it.
because you can decide for your own house, but if then suddenly a cell tower is right in front of your house, what can you do?
Right.
So that's where we need policy at the level of nations, by governments. They are the ones who should protect their populations.
That's right. So maybe we could talk a little bit about some interesting things that happened. And I wish there's a comment. It says, thank you for your ongoing efforts to bring attention to this important exposure issue. Oh, yes, absolutely. It's one of the most important issues, is the exposure to our children in
terms
school.
of
self. They were a health regulator in health in the United States. The FCC does not. Yes, they deferred. The FCC deferred to the FDA, and that is what they've done in all of our meetings as well. Is they say that they want to hear from the health and safety agencies, but the health and safety agencies, as far as I know,
Yeah.
of course they checked into this. I mean, Oh, the kids are using cell phones. Surely, surely they tested to make sure they were safe before Atlanta, Georgia them email publicly communicate that this is important.
Count on yourself.
Scientific that um,
we we
published, you know, there are not trash to pick up the pieces and getting led hands on deck.
Yeah.
Many health risks and well informed speech.
And it, only me. One. Computer.
if you're going to expose them to something that is going to cause our children to be sick.
Yeah.
This is yeah. This is what I hope every parent who's listening will take the time to learn more about this issue, to talk about this issue, and to ask for protections for your children, because it's not necessary to have this radiation exposure in our schools. And what
Exactly.
So there's more comments here. Can we introduce legislation for criminal charges
Study. On experiment. 15 and need to have a new it's good if to do so. Just over time. terms of treatment.
I mean, anytime you get a deaths may have been averted.
It's unbearable.
Right.
To keep on seeing those increases in cancer. Prevention.
Right. About is that cancer is just to radio frequency radiation.
Yeah.
Increase true because
colors and signals, and so
by everyone, and my gosh, we've just been chatting for so long. It's our first Facebook
Especially
Live.
you have a long drive waiting for you.
Yes,
so.
I'm gonna. It's gonna be 3 in the morning or something. Well,
But think about it.
And to educate your community, your politicians, get resources, please contact us at Environmental Health Trust, info@EH. That it
really cause cancer? It's been a question that's dodged researchers for years. Now, but a group of experts are now saying the results of some tests are pretty surprising. Here is consumer editor Susan Copen.
Millions, maybe billions of us constantly call, text, click, take pictures, and play on our cell phones. Even the top cellular radiation researchers from around the world have a hard time untethering. But they gathered recently in North Carolina to talk about cell phone concerns and whether they really do increase our chances of developing cancer. The panel voted that the results from years of testing on mice and rats were more significant than originally thought. They say they found clear evidence that phone radiation caused tumors in the hearts of rats, similar to tumors in people.
In humans, it's seen in the vestibular nerve in the ear, the acoustic nerve. We found it in the heart, although our animals were exposed in their whole body condition.
While a given animal is not making a cell phone call, they are, throughout their short 2-year lifetime, getting the same exposure that we would expect people to get in their 70-plus years of life.
Activists are now calling for more protections, citing separate studies from France and Italy.
Many brain tumor lawsuits going on right now that are waiting for a study like this to prove that people's brain cell phone radiation.
And there are new concerns on the horizon. 5G is about to debut a stronger system of broadband. Some activists say the government has a responsibility to increase regulations.
And I think it's also a responsibility of the ones making up the phones to make them as safe as possible. And I'm sure they can do better than what we actually have.
Susan Copen, KDKA TV News.